Hi, it's Bob Pike at Pike Chiropractic in Uptown Keswick with a short message about the new health model. The new health model is the 1-2-3 health model, and we need a new health model because the existing sick model isn't working for us. Here it is. The crisis is shaping up to be a potential bankruptcy for the Canadian people. So number one here is to find the contradiction and fix it. Number two is to find the new model and understand it. Number three is to take action according to the new model. So number one, where's the contradiction? Let's have a look. So here's the word stress, and it says we are living in a health continuum. A health continuum obviously is something which is an extension. Either way, you can go from where you are towards something or from where you are away from something. So what is it we're going towards or away from? And this continuum here is it's the health continuum. So we start out in complete health, and then for many of us we kind of take on more stress than we can handle. And when that happens, the system, by meaning system I mean the body that you're living in, begins to subluxate. And what does subluxation mean? Subluxation means it is a distance, it distances itself from the source of its organizational and integral forces. Now that might sound complicated, but it's very simple. So you're either less alive or more alive. The more overwhelmed you get from stress, by taking on more stress than necessary, your system subluxates. And subluxation takes different forms. It can be subluxation in your diet, where you just stop eating properly. Subluxation in how you breathe. Instead of you're breathing in your upper little chest area instead of in your abdominal area. Subluxation can happen in any system. And of course the most severe subluxation is the master system, which is of course the brain and the spinal system and the nerve root distribution to all of the cells, all 50 trillion cells in the body. So subluxation then leads to dis-ease. Dis-ease meaning that the body is now adapting. So this is what we all do when we're learning something new. If we're learning how to walk when we're kids, we adapt by falling on our butt frequently. And the principle extends throughout our lives. And so if we don't handle the dis-ease, a good example of dis-ease is food poisoning. So your body's really freaking out, but you're not sick. You're just being detoxed, but according to the intelligence of the body to prepare you for the next meal, hopefully which will be less toxic. If dis-ease with the hyphen is not dealt with, then it becomes disease. And then the last thing really is symptoms. So this brings us to the contradiction. Right now, most of us are under the impression that we don't do anything about our health unless we have a symptom. True or true? So the symptom is the most common symptom that drives people in droves to the healthcare practitioner, whomever it may be, is pain. So the contradiction is this. Most of us who are waiting for this symptom to drive us to some form of remedy, some form of self-care or some form of healthcare, are also very well aware that there are major epidemics going on, pandemics like cancer, heart disease, diabetes, obesity, chronic stress, chronic pain, even reactions to narcotic medications and any form of medications, even over-the-counter medications. These are driving, as I said earlier, our country into massive economic imbalance. So fix the contradiction. How we fix the contradiction is by finding a different system. The different system is the continuum. Understanding that continuum was number two. Understand where you are on the continuum. And understand that we're always taking on stress. It doesn't go away. The subluxation is something the body's always doing. So now, number three, take action. How do you take action? Well, you have to adopt the new model. The new model is the health lifestyle. And the lifestyle is also a continuum, right? So how's your exercise going? Are you happy with how your exercises are? How's your diet? You got it dialed in yet, or are you still eating things that are going to subtract energy from your body rather than adding it? So that's another contradiction. So the contradiction I'm recommending in this situation relates to subluxation of the spinal system, which happens to be the master control gateway between the brain and the body, and between the body and the brain. So make sure you're under care of a chiropractor. Go to pikechiropractic.com, check out our new stress survey, the new stress scan. Very simple to sign up. Looking forward to serving you and seeing you there. Thanks for now.